So I created a model called couple-centered recovery. That's a whole different talk. But just so you kind of know what I'm drawing from, basically 4 different things that there's nothing new under the sun. I just pulled from what I like from a bunch of other things and put them together because they seem to work. So it's basically 4 theories or models with one sort of concept holding them all together in the middle. Drawing from adult attachment theory, the idea that feeling safe and secure in a relationship is a vital need for our clients. This is something everybody needs. Drawing from developmental neurobiology, that we have to understand the difference between a deficit and a defense. There's a difference. When people are just got their defenses up, their defense mechanisms going, that's different than if someone has a deficit. They weren't mirrored as a child. They don't have the capacity for certain levels of self-regulation, and we've got to treat those differently. And we've got to recognize that for both the one who did the betraying and the one who was betrayed. And so we have to meet people where they are developmentally and help them expand their capacities when necessary. Affect regulation theory, the work of Alan Shore. I'm a big-time Alan Shore geek, if you're familiar with his stuff. What I say is less important than how I say it, right? This is about accepting the reality that our nervous systems are constantly affecting each other. Even right now, my tone of voice is affecting your nervous system. Your facial expressions are affecting my nervous system. So be nice. We connect in order to resolve conflict. We don't resolve conflict in order to connect. Here's what I mean by that. I've got a couple, their lives have just been blown up. You know, the betraying partner, his or her secret life of however many years has been discovered. The betrayed partner's life that they thought they had, they just found out wasn't what they thought. Lots of conflict there. They will never resolve conflict with their prefrontal cortex offline. And as long as they feel threat with each other, their frontal lobe's not fully online. A little bit of connection. I'm not saying they're gonna go jump in the sack after the session. A little bit of connection, a little bit of empathy, a little bit of compassion, a little bit of attunement to help them regulate each other. We're helping them co-regulate each other. Now we can work on some meaningful stuff. Super important in doing this work and in this model. Relational cultural therapy, anyone familiar with relational cultural therapy? It actually comes out of feminist psychology. I love this model. It's a beautiful model. The claim of this model is, when I do what's best for this relationship, I'm doing what's best for me. I never have to choose between what's best for my relationship and what's best for me, because if it's not good for this relationship, it's not good for me. That's a major paradigm shift. It's only safe, though, if both people are playing by those rules, and we'll talk about that more in a little bit. And then the last piece, which is just sort of more of a concept that holds it all together, is values-based self-activation. I have to own the trajectory of my own development. Now, that doesn't mean, you know, at 40 years old, I can say, I think I want to develop into an NFL player. That's unlikely, right? But I can decide if I want to become a more compassionate person or not. I can decide if I want to become a more patient person or not. Decide if I want to be a more transparent and authentic person or not. And I do that choice by choice by choice by choice. And when we call people to their values and to principles, they can function securely even if individually their attachment styles aren't secure.